impromptu things like many surgeons. So
Oh,
we'll see how this goes.
oh,
I hope I'll give you what you want.
you'll be great. Okay, let me see here. And then you're gonna look right here.
Right,
I'm gonna be here, you'll be looking at me.
right.
Um, sorry,
No problem.
gotta,
Don't look into the camera. Okay.
okay. So, maybe just start by, um, with an introduction, give me and look right here at me. Um, you can look, yeah.
Yes.
Okay, so just an introduction, your name, what year you're in the program, and
Right.
that you're in the orthopedic program.
Yeah. My name is Peter Waweru. I'm a fourth-year orthopedic resident at Tenwek Hospital with PAACS. Yes.
Ah,
Yes.
great. And you're the Peter
Yes.
in surgery.
Yes, we were.
I don't recognize anyone because of the mask.
Yes, we were together yesterday in surgery. Yes.
Okay,
Yes.
great. So what made you want to become a doctor?
That's a good question. I think from the time I was young, I did want to become a doctor. Most of my influence was through the people I worked with, or rather I got to be around at the time. None of my family members were doctors, but I had an extended, like an uncle from my father's side who was a doctor. Um, I got to see what he does. I got to see how he helped people, including my brother. Actually, there's a time he had a forearm fracture, and this was a guy who helped us through the process. So I think some of that really played a key role, but to some extent also just wanting to venture into something new, because most of my family members were accountants. My dad was an engineer, so I think I wanted to try something new. Yeah, yeah.
Hmm, that's great. Um, how did you hear about the PAACS program?
Yes. Now that's I think a more interesting journey. I was an intern at PCH Ogoria. It's a hospital at the root, like at the foot of Mount Kenya, and I got to work with a PAACS surgeon. His name is Dr. Elijah Moora, who is now the CEO of the hospital, but during that time he was the head of surgery. So we got to do a lot of cases with him, but I think you could, like right from the get-go, you could see he was a different surgeon. He was compassionate, he was a teacher, he was guiding us through the procedures, but also more invested in other aspects of the hospital like leadership. And I think just looking at him, he's a big reason why I heard about PAACS and a big reason why I decided to pursue PAACS. Yes. Then I decided to get into orthopedics because I worked with an orthopedic surgeon also at Chogoria Hospital, who I thought he did a great job, like with his patients and the kind of procedures he was able to do. And putting those two things together, I decided to apply for PAACS in orthopedics. Yes.
Wow,
Yeah.
that's great. Um, so, what has your experience been with PAACS, the PAACS residency program so far?
Yeah, so I think I've had a great experience. I did my first 2 years at Kijabe Hospital, then transitioned for my last 3 years at Tenwek Hospital. And throughout, PAACS has been a unique journey. I appreciate the mentorship. I think that's one of my biggest highlights that we get from our consultants. I appreciate the kind of skill and knowledge that we are given. And everyone has been so intentional in terms of pouring into us, investing in us to the point where we will be able to give back. So I've had a great journey so far, and I'm happy to be working with those who are before me, including some of the PAACS residents who've recently graduated into faculty. And when I see them, I look forward to how that process is going to play out in my life as well. So yeah. I'm sorry. Yeah, there's some.
Is that outside?
Yes.
Oh, okay.
Sorry.
Um, it should be okay. Can you describe a moment during your training with a patient, whether it's spiritual or that has impacted you? A patient story?
Yeah, I have quite a number, to be honest. I think here in Tenwek we serve a very big population, so we get to see a lot of patients from different walks of life. Most of my patients who've really impacted me have been from the Maasai community. I remember a young man we'll call him Jay. Jay is like 15. He had a femur fracture early on and was managed at another facility. Later on developed a complication and came to us. He's had a long journey in terms of his recovery, especially in terms of his complications, but it's also been a time when we've really got to know him and his family and walk with him. And I just thank God for giving us the opportunity to be able to take care of people's physical needs, but other than that, their spiritual needs to the extent that we can through our conversations, through the chaplaincy, and also just seeing someone go through that journey, like their psychology changes, their outlook on life changes, based on what we are doing for them physically, but even much more than that. We can truly say God is at work in this place. I think another story is, I'll call her S. S was a 23-year-old female teacher who got into an accident, sustained a fracture to her femur, and we had to unfortunately amputate her limb. So we had to take out her limb to save her life, and it was a journey for her. You could tell psychologically she was going through a lot. She was just about to finish her training as a teacher, and that kind of got deferred because of where she was. And it's been amazing to see that eventually she was able to get a prosthetic leg. But more than that, one of the things I really enjoy was we shared Psalms 23, and during ward rounds, like we would ask her whether she's memorized the verse when she comes with the chapter when she comes to clinic. That's part of our conversation, and I think I really enjoy that. I enjoy that sense of community with patients, that sense of fellowship with patients, and even for her, her outlook on life is really different. She's very positive. We actually now use her as one of the examples for some of the patients who've gotten amputations to be able to just encourage them along the journey. So there are many stories like these, but I think those are the two that come to mind at the moment. But I am grateful that God gives us the opportunity through PAACS and through Tenwek to be able to be a part of patients' lives to this extent. Because to be honest, these are some very gruesome injuries, and at times it's points in their lives where they're very low. They're in pain, sometimes in financial need, sometimes in physical need, but being able to carry them through that journey by the grace of God is a unique opportunity. And to be honest, we're very grateful for that. Yeah.
Wow, that's great. Good response. Now, they talk about the two tracks of PAACS, not only the surgery training, but also the discipleship training. Can you talk about the importance of that, or in your experience?
Yeah. We all know, like, we get very good training in terms of our skill and knowledge, but also I am grateful to my seniors, the chief residents, the consultants, because everyone is so key in terms of shaping how your life and your career as a surgeon is going to pan out. And they have been very good examples. Even when we start talking about placement at the end of your training, it's important that you get this guidance. We try and walk. They try and walk together with us, directing us in terms of our family lives, our spiritual lives, and our lives beyond residency, and it helps form us, especially at this stage, because it's a very formative time in our careers, and I'm grateful for that. This is also one of the strengths of PAACS, and it's great.
Hmm,
Yeah.
that's good. Thank you. Um, what has been one of the biggest challenges that you faced as a resident?
Wow. Personally or in general?
Uh, personally.
Okay. um, so maybe just to highlight a couple of things. Definitely, the training is quite intense, and I'm sure this is something that most people will agree. So long hours, um, lots to read, exams coming up. Uh, like those are general things, but for me, uh, like we had to spend some time apart with my wife because she's also in training at the moment in Kijabe. The dynamics of that have been quite difficult, but also I've really gotten a lot of support from my end of the program and from her end of the program. But yeah, personally, that's been the most challenging time.
Mm.
Yeah.
What is she training?
Oh, she's also a PAACS resident at Kijabe. She's doing anesthesia.
Oh, wow.
Yes,
Hmm,
yes,
that's exciting.
yes.
You'll be a great team.
Yes, that's what everyone says.
That's good. Let's see. Um, so, looking to the future, what's your hope after you finish, you graduate?
Yeah, so I have 1 year left and some months to finish. And really, I think for me and my family, we're in a time of just trying to figure out what God has in store for us. Initially, as I've mentioned, there was a huge part of my career that was influenced by Chogoria, so that's one of the places I wanted to go and give back. But trying to figure out what God has in store for us in terms of placement after. But really, we would like to be in a place where we can both serve. We're constantly speaking to our consultants about it, just to get a sense of how or where people think might be a good place. So I don't really have something concrete in mind, but our hearts are to serve, to give back. In terms of where, we don't know yet, but I think we'll know with time.
Mm.
Yes.
Now, are you hoping, now is Chigoria considered like an underserved area?
Yes, yes.
Could you just talk about, I mean, I think the hope for PAACS is that people will end up going to.
Correct. Yes. Yeah, so Chogoria is a mission hospital in Tharaka Nithi County, and they serve basically the entire county. They get to see a lot of patients. I did an external rotation shortly, maybe for about 3 weeks this year, and there's truly a need there for orthopedic services, for general surgery services. But Dr. Eliza is doing a great job at Chogoria. I think having an orthopedic surgeon for them would be a great advantage to be able to improve the kind of care that they give, improve the training for the residents and the juniors that they have. So that's somewhere I think I would want to go and explore and see how best to give back. Yeah.
Could you just encapsulate it, all that information into something very quick to say, my wife and I are hoping to return to or go to an underserved area,
Yes.
and we're trusting the Lord to
Guide us.
Okay.
Yeah, so as I'm in my 4th year now. I finish next year. My wife is in her 1st year. She finishes in 3 years' time. But at the end of our training, we are trusting God to lead us to an area where we can give back in an underserved region in Africa and see what God has in store for us. We're seeking the Lord and asking for guidance from our faculty, and they're praying with us concerning that decision. Yes.
Perfect. Thank you. Let's see. what is your hope for the future of PAACS? Now they're celebrating 30 years, so just looking forward, do you have any?
Yeah, I think based on the caliber of people that PAACS churns out into the society, I think PAACS has a unique opportunity in Kenya, in Africa, to be able to shape the leadership of healthcare in the next decades to come. And we're already seeing that, like Kijabe has had two CEOs who are like beneficiaries of the PAACS program. Chogoria is the same. And even in Tenwek, we see a lot of residents who've gone into leadership within the hospital and outside the hospital. And I think this is the future for PAACS. Training residents will be able to become surgeons, anesthesiologists, obstetrics and gynecologists who will be able to impact even outside the operating room, even outside the one patient encounter at a time, but to be able to shape policies, to be able to foster resources that can really help shape the healthcare in this continent. Yeah.
That's great. How would you say thank you to the people that are supporting you in your program?
Wow. I think we're very grateful. We are very grateful for the support that we get personally, and even the orthopedics department at Tenwek. We are truly blessed with the kind of resources that we have and the kind of impact that we get to have. Honestly, asanteni sana, that's Swahili for thank you very much. And may God bless you. May He keep allowing you to do and to pour out the good that you're doing to us. And yeah, I'm very grateful. Yeah.
That's great. Is there anything else you would like to add?
Nothing else, just grateful for this opportunity. I'm happy that PAACS has come a long way. 30 years is quite a milestone. And to be honest, looking forward to what we can achieve with PAACS in the next 30 years. Yeah.
Wow. That's great. Okay, thank you.
Nice.